These days, both seasonal fall allergies and increased stress can lead to more headaches. Dr. Matthew Bessom of Summit Medical Group has more on the types of headaches, their triggers, and their causes.
There's at least 3 different types of headaches that we can see. The most common would be migraine type headache, usually described as throbbing on one side of the head versus a band around the head. The second kind would be a tension type headache. Feels more like a squeezing or tightness, usually on both sides. And then the third, less common, would be a cluster type headache, which can be quite excruciating and come in waves. There can be a number of reasons that someone might get headaches. Certainly migraine can be just a condition of genetics. Sometimes tension type headaches, there's a number of causes. Stress is a very common cause. And we see it quite often. And certainly this current climate, there's a lot of reasons for there to be stress. Job loss, school, virtual learning, lots of reasons to have tension type headaches. There are other causes outside of stress that we see routinely. Sinus headaches, whether that's a sinus infection or ear infection or allergic symptoms. We see headaches commonly associated with the inflammation, swelling of the sinuses. We see that quite commonly. Some headaches are also commonly caused by things that people ingest, whether that's alcohol, nicotine, certain medications, artificial sweeteners, and some of my patients swear that they can't have chocolate, that it causes a headache quite commonly in them. If you have a headache, it's always okay to take something over the counter, such as Tylenol or its generic acetaminophen, or an anti-inflammatory like Aleve, Advil, or ibuprofen, assuming it's okay considering your other medical conditions. I would always recommend you contact your physician if you're ever concerned about your type of headache. If it's different, if it's new, if the medication you're taking is not working, or you're concerned about what you should be taking or not taking. These are quite common questions that we get, and a good reason to call your physician. Most of the time, headaches are quite benign and very common. Occasionally, headaches can be a sign of something underlying that can be quite severe. So if there's ever associated symptoms like loss of vision, nausea, vomiting, or the classic phrases, "I'm having the worst headache of my life," certainly reach out. But if your physician is not immediately available, would recommend emergency treatment. There are certain types of headaches that aren't easily abated with over-the-counter options and require prescription treatment. There are numerous options available. Whether it's something to be taken on an as-needed basis to stop the headache or something taken regularly to help prevent them. One of the most common causes we see for headaches is stress, whether that's financial stress, stress related to job loss, school versus virtual school. We see it quite commonly. Seasonal allergies are also a really common cause related to weather change, climate change, new allergens. Your sinuses get inflamed and can cause that tension type or even migraine type headache. We see them all the time. Different people have different types of allergens, so I tend to see a swath of new headaches and new allergic type symptoms with every season change. So the most common would be coming into the spring and coming into the fall. So not uncommon at all to have sinus headaches, sinus infection in either of those seasons.